Plastic surgery is nothing new. Being founded by Sushruta, the father of plastic surgery in modern-day India, 600 BC with the rhinoplasty, humans have been looksmaxing since before indoor plumbing. Surgery to improve humans' quality of life is nothing new. First, I will discuss what plastic surgery is and the different types. Second, I will discuss the socio-economic trends of cosmetic surgery. And lastly, we will discuss the effects on identity. Aesthetic versus reconstructive surgery. Aesthetic surgery improves a person's appearance / erases signs of aging on normal regions of the body. Aesthetic surgery uses client instead of patient, since society deems these procedures as vain and unnecessary, which so does your insurance company, which is why they are not covered on basic plans, and also why the government likes to add a service tax to these patients. Which, now that we know what aesthetic surgery is, let's talk about reconstructive surgery. Reconstructive surgery is a type of plastic surgery performed to correct abnormalities caused by disease, trauma, birth defects, and other causes, offering life-changing transformation, confidence, and return to self after a medical event. Nearly 1 million reconstructive surgeries are performed every year, according to the Cleveland Clinic. Now that we know what plastic surgery is, let's get into the socioeconomic trends. Social media ads and scams. Social media has become the #1 place for advertising for plastic surgeons. Those late night infomercials, those dramatic before and afters, are now on your For You page. According to the Aesthetic Surgery Journal, a total out of 1,789,210 posts utilizing 21 hashtags in the study, only 17.8% of top posts were from plastic surgeons eligible for membership from the American Society for Aesthetic Plastic Surgery, whereas non-eligible physicians accounted for 26.4%. Board-certified physicians were more likely to post educational content on their pages, so it's kind of one way to spot them out. Many patients needed correction to botched surgeries performed by non-plastic surgeons. Cosmetic surgeons are not necessarily the same as a plastic surgeon. It's important patients know the difference, Dr. Dorfman says. The pandemic's effects on plastic surgery. Many patients reported that due to not traveling as much, they used those budgets for cosmetic surgeries instead. Combined with the shift to remote work, healing became easier and less burdensome, and also a lot more discreet. Speaking of the shift to remote work, Zoom boom was another leading to cause. People were consistently seeing themselves on the Zoom cameras, and those selfie cameras can be brutal and unforgiving, causing people to want to make changes. Although previous studies have shown a positive association between plastic surgery case volumes and economic performance, the unprecedented inflation following the COVID-19 pandemic, coupled with the interest in plastic surgery, challenges these historical trends. Now that we understand socioeconomic trends of plastic surgery, finally, let's discuss the effects on identity. Majority of those who undergo plastic surgery have positive outcomes in psychological and psychosocial terms. But here are some predicators to bad outcomes. Being male and younger age, history of anxiety and depression, body dysmorphia and personality disorders, and relationship issues, being motivated by the belief that cosmetic surgery will help save a relationship, as well as a disagreement between partners if the procedure is even necessary, as well as previous botched procedures and unrealistic expectations. Identity change and the emotions. Even when the change is positive, it can be difficult to process while one heals and waits for the final results. Our identities are often tied to our appearance. If you have a surgical process, it is quite sudden, says Dr. Banks. You went to sleep one way and woke up another. That is a real identity change. Dr. Banks is sure to warn her patients before body contouring surgery that they will go through a second puberty, which may be quite emotional for her patient and spouse to handle. Identity change and the mental adjustment. So reactions often tend to need some time to let that heal. But on the other hand, you could be among the patients who seem to embrace their new physical reality instantaneously. We do vaginoplasty, says Dr. Ramirni. The patients have a penis, and then literally it's gone the next day. And so a lot of these patients get a post-procedural euphoria with it, where they're excited because they feel like they're finally in the body they were meant to be in. So sometimes, yeah, you're going to look worse before you get better. But it's important to know this. And the key is to be patient with yourself. Give your mind time to catch up with your body, and don't be afraid to lean on support. It's not just a before and after. You're human. And the emotional side is important as well. Today we talked about plastic surgery, what it is, and the different types, the socio-economic trends of cosmetic surgery, and the effects on the identity. I hope next time you hear about plastic surgery, you can understand surgery to improve humans' quality of life is nothing new.